you love it?
I do love it.
So our patient is 67 years young, and exactly a year ago, we did a lower body lift on her, and just look how amazing she looks. I mean, just look at her backside. It's gorgeous. And the placement of the incisions, not too low, not too high. She can wear a thong, and none of you will ever know that she has had a complete lower body lift.
I feel more comfortable in my own skin.
Yeah.
Yeah. After losing weight, you're still not happy because now you've got loose skin.
Thank you. So we're looking at one of our patients. She had a lower body lift done about 3 weeks ago, and she's healing super well. I couldn't cut all of her abdominal skin up to her navel opening, so we actually closed the navel opening on itself and pulled it down, and that's this tiny scar here. The rest of her scars are healing beautifully. She still has a ton of swelling and inflammation as to be expected. That will take us about 3 to 6 more months to subside, but you can already appreciate the definition that has been built into her abdomen and the tightness of her thighs. I mean, look how beautiful these thighs are from the front. I'm gonna rotate you. Outer thigh smooth, the back is perfectly smooth, and she can wear a thong and hide her incision. And look at that. See how perfectly her thong covers her incisions, and her incisions are healing beautifully. Is that symmetrical? Okay, look at that. I'm very pleased with her healing. As I always say to everyone, half the surgery is me, half of it is you. My half is a surgery, your half is healing. And I think we made a good team. And today I have the pleasure of seeing one of our patients for follow-up. She's 4 months out from a lower body lift, and she just looks fabulous. So I couldn't not share this result with you. So she's just told me that she's put a few pounds, but she looks amazing. And you can see how beautiful she looks. She's got a beautifully sculpted, high definition tummy tuck, and this is her incision. So still a little bit red, and this is gonna get much better, but you can still appreciate her beautiful definitions and her overall correction. And just look how tight her thighs look, and you saw her butt. So there you go. I'm so excited to be seeing one of our patients. She had a lower body lift and an arm lift in 2017, and just look how fabulous she continues to look. So you were telling me that you've gained some weight and lost some weight since then?
Yes, I have. Well, I did have I had another surgery in November of last year, so I've been a little bit immobile. So
Yeah.
I have put on some weight, but now I can get out and be more active. I've lost about 10 pounds the past 2 months, so
Excellent.
it's coming down again.
Okay, so despite the minor weight gain and weight loss, she has maintained the results of her lower body lift that we did in 2017, and just look how fabulous she continues to look. This is 6 years out, and you can see that the incisions are still perfectly placed in relationship to her thong, and she still has maintained the buttock augmentation and the fat transfer and the flap and the thigh corrections and so forth.
I am so happy. It's like, there's always a little bit that we want to improve on, but I have to say overall, I'm very happy with my decision to have the body lift done.
Thank you. Looking at our beautiful patient who had a lower body lift with a tummy tuck scar revision about 4 weeks ago today, right? And what do you think?
I love it. It's better than what I expected.
Yeah, you've healed really remarkably well. I'm so excited for you. As I always tell everyone, half the surgery is me and half of it is recovery and healing, and I don't have any control on patients' healings. So you can see how well she's healing. She's still healing. This is only 28 days old, but You can see how perfectly these scars are placed. Her abdomen looks beautiful, defined. We pulled her thighs up, and then as we rotate her, you can see the smoothness of her thighs, and then her back looks phenomenal. She's got a nice buttock enhancement and a beautifully healed incision on her back that is symmetrical, nicely placed at the junction between the lower back and the upper buttocks. Now, she does have swelling. Some of this will go down. When I start planning surgeries, I always plan surgeries globally with intention of being able to continue to make it better and better. Bake the cake first and then put the icing on it. How do you rate your results?
I'm ready to eat this cake.
So we are 10 weeks out from her lower body lift redo, outer thigh lift redo. I'm saying redo, but I think some of the surgeries were not even done, meaning that she had a basic circumferential tummy tuck, which in our practice is not the same as our high definition lower body lift. Anyhow, we lifted the outer thighs, the thigh fronts, repositioned the buttock again, and did a vertical thighplasty, which is a thigh reduction. It is quite a lot of surgery, given the fact that we also did buttock enhancement, liposuction, a redo buttock lift, removing 5 or 6 inches of additional skin. It is a lot, but when you do a comprehensive correction, you get a comprehensive result. And sometimes if you try to do these in pieces, you'll never get exactly the same result. So, was this surgery harder than the first surgery that you had 6 months prior to this?
Yes, definitely much harder.
Much harder, right? And the recovery was harder, right?
Yes.
Yeah. So it's harder because we have done a lot more. If I count the number of procedures that we put into a lower body lift, it's a lot more than your average lower body lift. Here she had buttock lift, buttock augmentation with lower back fat pads, liposuction, fat transfer, lower back liposuction, saddle back liposuction, outer thigh lift, thigh front lift, waist reduction, and in her case, vertical thighplasty and thigh liposuction. So a lot more was put into it, so we get a lot more out of it. And what do you think?
I love it.
Big change?
Big change.
And she's healed remarkably well.
I followed all your instructions. I ate plenty of protein, did the vitamins, rested.
Yeah.
Yes.
Thank you.
Thank you.
So about 3 weeks ago, we did a lower body lift on our patient who is in her 60s. People always ask me what's the upper limit of a lower body lift, and I typically say it really depends on your medical history, because you can be fit, you can be healthy, and you can be older, or you can be young, unfit, and with medical issues. So if you're a healthy person, even at an older age, you can still do plastic surgery. And our patient had a lower body lift. It's only been 3 weeks, but she looks pretty amazing. You can see how beautifully she's healing. These are her back incisions. One here and one here. I'm just gonna pull this down. You can see that perfectly. Also, what I wanted to appreciate is the amount of correction of the outer thighs. So I do a very comprehensive lower body lift that tightens the lower back, the upper buttocks. Typically, I do buttock enhancement with any tissue that we have. If we liposuction the patient, we use that tissue. If we have a lower back fat pad or a roll, we use that to augment the buttocks. I do combination of buttock lift, buttock enhancement with lower back fat pad, and Brazilian butt lift to achieve a fuller buttocks. And then an outer thigh lift, waist reduction, usually a full tummy tuck, and in the front we lift the thighs as much as possible with a pubic lift. So we're only 3 weeks out. Our patient is continuing to heal, but you can appreciate how perfectly these incisions are placed. She can wear a thong and enjoy her new 21-year-old body. And right? And then look at this. Look at her definitions. It's normal. She's got beautiful three-dimensional contour of her abdomen, fullness, more fullness in the middle over the abdominal rectus muscles, less fullness over the oblique muscles. Some people have asked me whether I did this with liposuction, and the answer is no. This is a result of the high definition tummy tuck, which is a different technical procedure. Yes, I use liposuction to enhance the results, but it's not a high definition liposculpture. This is more of the result of the technical aspects of the high definition tummy tuck, bringing and creating more fullness over the abdominal rectus muscles. And you can all appreciate how beautiful she looks. And she's only 3 weeks out. She's gonna look fabulous. Yeah, she does already.
2.5 years for body lift.
You can see her beautiful high definition result. And let me just try this out. This is her scar on this side. Again, in an underwear or a thong, you can't even appreciate the scar. Come closer, look at this beautiful navel and the fact that she's maintained her results 1 year out. She looks beautiful, her abdomen looks defined, and she's working out, right?
Yeah.
Right, okay. And then on the back, once I position this symmetrically, just look at her buttock enhancement. She has scars, obviously. These are the scars for the buttock, perfectly and symmetrically placed. But when she wears a nice thong, her buttocks look phenomenal, to say the least. And 1 year out, so everything is permanent. And what do you think?
I'm very happy. Very, very happy.
Thank you.